we have got a group session today. We've got 4 people from the PROACT team that are actually coming to talk to us about something that is absolutely prevalent across the Northwest. And it's around alcohol harm and what we can do to change that for good. So we are so grateful to have 4 of you here today. So we've got Lynn, we've got Mandy, we've got Ravi, and we've got Rory. And we're just going to dive straight in because we know that Lynn's already worried that 2 minutes isn't going to be long enough to tell you all about this amazing program. So I'm just going to share my slides with you now so that you can all see what it is that we're actually talking about. So tell us, what's the program about and why was it created?
So I'm Ravi. I'm from the Champs Public Health Collaborative. So we work for the 9 directors of public health across Cheshire and Merseyside. We work on those areas where it makes sense to collaborate across the whole of the patch. So alcohol harm has been a priority for a while now. That was before the pandemic because alcohol harms in our areas were some of the highest in the country. So obviously during pandemic, those harms were exacerbated. So some of the stats were shocking. So during pandemic, we had record alcohol deaths. That just seemed to rise as well until recently. So we made the case to the NHS Cheshire and Merseyside, the ICB, to make alcohol a priority. Our starting point was to support alcohol care teams, and that was to meet the aims identified in a 2019 document from NHS England. That was the core services script there for what alcohol care teams should deliver. And that was in terms of reducing alcohol-related admissions and reducing length of stay for inpatients by improving the management of withdrawal. So, it's going to be really quick, but the components include competency frameworks, clinical supervision, training, network events, and now a dedicated primary care education program. We took a co-production approach, which our clinical lead, Dr. Lynn Owens, will talk about. That includes a dedicated patient and public involvement group, GP champions, a senior nurse advisory panel, and the whole alcohol care and treatment system through the PROACT network. So with that, Lynn, I'll hand over to you.
Yeah, okay, fantastic. So tell us a little bit about your approach then in improving care for patients and for the families, Lynn.
Okay, so what we did was we looked at the system as is, and we spoke to people who work in the system, we spoke to families, and what we discovered wasn't a surprise to anyone. There is massive variation in quality, terms of access. It's different wherever you are in Cheshire and Merseyside. So we said, well, we need to level the playing field, make sure that every patient and every family knows what to expect and has the right to expect it. So we built a community where the central tenet was mutual respect, understanding each other's roles, understanding each other's challenges, understanding each other's services, and then working together to try and bridge some of those gaps.
Yeah.
So we want a confident, competent, happy workforce. And sometimes the challenges in the system stop us doing that. So we use our network and all our links to work better together, with always the central focus is there's a patient here and a family, and what can we all do together to make things better and remove some of those barriers that, quite frankly, anyone working in primary care, secondary care, A&E, you name it, we've all come across them, and they're very frustrating when you're trying to help a patient. So we've built a whole bookshelf full of products that are there and aimed to help you, the workforce, reduce that variation, understand the problems, and therefore surmount the challenges.
I would love to be part of that network. Absolutely.
You're welcome.
So, Mandy, tell me, what support's available for the workforce? And I think, is this the slide that you'd like to show?
Well, yeah, that's one of them. Yeah, absolutely. We've developed a range of products that can support the workforce, but we also have got an education program that's available to anybody who wants to attend, really. And that's delivered by experts in the field, and it's available on Teams, and it's also recorded so that people who are maybe can't make it can come catch up with it.
I think we've got a slide on that, haven't we, Mand? If
we have, yeah. So we've
down.
we've got a number of other products that we can share. We've got our alcohol use disorder guidance that we've developed, and that is for staff and patients, and it's just like quite an educational for staff, but and also guidance for patients. Just really describing alcohol use disorder, when a patient and gives advice on when that patient is sick and what to do with that patient once you've made your assessment. We have developed a dedicated primary care education system. We work with our GP partners to develop it so it's relevant to what is needed. We're running it on a Wednesday afternoon at 12:30 for half an hour. Again, that'll be recorded so that people can catch up with it. And really, essentially, what we've looked at is what do you need to know in primary care, and that'll be like when to refer to the hospital, when to refer to the community teams. If you just move on to the next next slide, Karla. So that's just an example. That's the actual program there, and that's running right through every monthly until June next year, June 2027. We also offer identification and brief advice training to all GP services. We've attended quite a few PLTs delivering education on when to refer in and how to sort of manage our patients who don't want to be referred anywhere. And that's it. Obviously, we also provide support to all staff, not just the alcohol care teams across Cheshire and Merseyside, but anybody who rings us really, for any advice or support, we'll support them. We're always at the end of a phone.
Useful.
Yeah.
And these are some of your monthly care programs.
Yeah. So that's the monthly. Yeah. So a couple of success stories are we are the only ICB that have actually implemented standardised screening for alcohol use disorder in pregnancy. And what we did is we worked with midwives, the alcohol care teams, and the community teams, bringing everybody together. Everybody's voice was heard, and we've developed a SOP now that's across Cheshire and Merseyside, and it's implemented so that every woman throughout her pregnancy will be screened for alcohol use disorder, and that's one of the ICB's goals, to reduce the incidence of fecal alcohol spectrum disorder. And we've also got our PPI group, our patient and public involvement group, which is everything that we've done is threaded. They are threaded through. They've read everything. Everything is patient friendly, patient and family friendly. So yeah, that's I think that's me. If I covered that.
That's amazing. It sounds like you've done a lot of work involving patients within the design of this. That's fantastic to hear. So Rory, tell us how have you successfully engaged with primary care so far?
Thank you very much. Hi everyone. So I'm Rory, and I am a GP champion for liver health for Cheshire and Merseyside. And there's 3 of us, and I'm fortunate that my colleagues Sangeetha and Sinead are both on the call as well. But our role is, just as you say, so our role is to make sure that this ties in with primary care on the ground. So you can see there on the left on this slide, this is a leaflet that's been developed by the ProAct team, which is brilliant, actually, which is really, it's in depth, but it's aimed at patient level. So we talked this through at length, and we think that the majority of these cases you kind of stumble across, it's mostly in chronic disease reviews, or it's unusual, that's the focus of the consultation. And it's how do we empower primary care to sort of to maximize that opportunity whilst still spinning the several million plates that we have to throughout a consultation like that. So the leaflet is aimed at patient level, and sort of and covers everything. And it's obviously you can have it in a physical form, or you could follow up a consultation by linking a digital form in some sort of text message. And us as GP champions, we think it's brilliant, but we were just keen not to alienate our colleagues because it's at patient level, and we wanted to complement it with sort of the latest evidence and make sure it was sort of pitched at a professional level also. But then obviously it's not just GPs that are stumbling across. As I mentioned, we think a lot of these will be sort of practice nurses doing chronic disease reviews and stumbling across this. So that's really where the document on the right came from. And the aim is, we know we're GPs ourselves, we know what our inboxes are like, being flooded with guidance upon guidance. We wanted it to be succinct, so it's a one side of A4, but just as an aid memoir to your screening tools, and to the various tools at your disposal to assess the severity of alcohol dependence, and then linking in with the resources available, reminding about Change, Grow, Live, but also to say that the alcohol team, we're not just here on the call today, that they can be contacted for help in these complicated cases. So that's been our contribution as GP champions.
Thank you so much. So can you believe that that's been 10 minutes already? Unbelievable. I think a huge congratulations to Lynn specifically, because, I know that this is going to be a challenge. And I see some more slides that you provided with us. We're just going to go to stop recording now. We're going to go to a little bit of Q&A. So anybody that's got any questions,